UMZIMKHULU, South Africa. The sudden freeze on U.S. foreign aid by President Donald Trump has raised concerns among South African NGOs, fearing that HIV patients will default on treatment, leading to increased infection rates and rising mortality. Unemployed 19-year-old Nozuko Majola from KwaZulu-Natal province is struggling to afford transport to collect her HIV medication. Normally, her medication is delivered to her home, but with rough, untarred roads and reduced resources, the service has become unreliable. Majola is just one of the millions affected by the aid freeze. KwaZulu-Natal recorded the second highest HIV prevalence in South Africa, with 16% of the population affected and an estimated 1,300 young people contracting the disease weekly, according to the 2024 Human Sciences Research Council report. The province also had the highest number of people living with HIV in 2022 at approximately 1.9 million. Nationally, South Africa has over 7.5 million people infected with the virus, the highest number in the world. The President's Emergency Plan for AIDS Relief (PEPFAR), which has contributed over $400 million annually to South Africa's HIV programs, roughly 17% of total funding, was suspended by the Trump administration. This funding supported 5.5 million South Africans receiving antiretroviral treatment. PEPFAR has been credited with saving at least 26 million lives globally since its inception in 2003, according to the UN AIDS agency. However, the recent freeze has forced many NGOs to shut down, with notices posted at their entrances and PEPFAR-branded vehicles left idle. Patients have been redirected to overburdened public. A federal judge recently ordered the Trump administration to temporarily lift the funding freeze, while the U.S. Embassy in South Africa announced that PEPFAR projects would resume under limited waiver. Despite this, many aid groups remain closed, and health workers funded by PEPFAR are uncertain about their futures. Majola and other patients in UMZIMKHULU, a region plagued by unemployment and reliance on subsistence farming, have found their lives severely disrupted. The lack of mobile clinics exacerbates the problem. Things will be tough around here, and a lot of people will default on their treatment because we struggle with transport, Majola. In addition, nearly 1,500 health workers whose salaries were funded through PEPFAR are now at risk of losing their jobs. In the Ngungolovu district, which has the highest number of HIV cases in South Africa, counselors and health clinic staff are struggling to manage workloads after PEP-funded workers withdrew. People who were doing administration and data capturing whose salaries were funded by PEPFAR have left. We are a small facility and we cannot handle such a workload, said the clinic manager, speaking anonymously due to restrictions on speaking to the press. Long-time HIV patient Nozuko Majola, who has been on treatment for 30 years, expressed concerns about the impact of the aid freeze. One of her children, also infected, died at age 17. Not long ago, we said, by 2030, we want to see an HIV-free generation. But if things remain as is, we will not achieve that. We will have to deal with deaths, she said. Mezamu Zondi, a provincial manager of the Treatment Action Campaign, emphasized the severity of the crisis. Our response to HIV is likely to falter as we struggle to stop newly infected cases. This is a matter of life and death, he warned. Despite court intervention and the U.S. Embassy's partial resumption of PEPFAR projects, the damage caused by the aid freeze is already being felt. South Africa's HIV response remains at risk, with thousands of patients unable to access treatment and healthcare facilities under immense strain. NGOs and healthcare workers continue to advocate for a full restoration of aid to prevent a catastrophic public health crisis. I am Jojo Uimana. Thank you for watching. This is KPro TV. Don't forget to subscribe.